Most people believe that the top number in their blood pressure reading, the systolic, is the one that really matters, and that the bottom number is just extra information. That belief is not only incomplete, in some cases it's dangerous. My name is Dr. Zeno Phantom, and I've been practicing medicine for over 15 years. And I can tell you from experience, some of the most serious cardiovascular risks I see are missed because people focus on the wrong number. Let me give you a real example. A 58-year-old male patient, a school principal, came to me complaining of fatigue, poor sleep, and occasional dizziness. His blood pressure readings looked almost fine at first glance, 128/96. He told me, "Doctor, my top number is normal, so I think I'm okay." But that bottom number, 96, told a completely different story. After addressing his underlying insulin resistance, stress hormones, and vascular stiffness, within 3 months his numbers improved to 118/78, his energy returned, and his sleep normalized. Today I'm going to show you exactly how to interpret both numbers, which one is actually more dangerous depending on your condition and what your body is really trying to tell you. Because here's something most people don't realize. According to the World Health Organization, over 1.28 billion adults worldwide have high blood pressure, and nearly half don't even know they're at risk. Most people miss this because they're treating blood pressure like a static number, when in reality, it's a dynamic signal of what's happening deep inside your metabolism, your arteries, and your hormones. This isn't just about avoiding a heart attack. This affects your energy, brain clarity, fat-burning ability, aging process, and even sleep quality. Here's what's really going on inside your body. Blood pressure is not just pressure. It's a reflection of how stiff or flexible your arteries are, how your kidneys are regulating fluid, how insulin and cortisol are influencing your vascular system, and how efficiently your body delivers oxygen and nutrients. In this video, we're going to break this down simply, like a whiteboard session, so you can finally understand what your numbers mean and how to fix the root cause. And most importantly, I'll give you practical, natural strategies you can start using immediately. If you're serious about optimizing your health naturally, consider subscribing. I post content like this every day. Now let's start by looking at the 6 key insights that almost nobody explains properly when it comes to blood pressure. Before we break this down step by step, let me give you a clear roadmap of what you're about to understand. Because once you see these 6 insights together, blood pressure will finally make sense in a completely different way. These are the exact mechanisms I walk my patients through on a whiteboard. 1. Systolic versus diastolic are measuring 2 completely different problems. One reflects arterial stiffness and pressure during contraction, while the other reflects resistance and pressure during relaxation, and confusing the 2 leads to wrong decisions. 2. A normal systolic with a high diastolic is often an early metabolic warning sign. This is commonly driven by insulin resistance, chronic stress, and vascular tension, not aging. 3. High systolic pressure is more dangerous after age 50, but not for the reason most people think. It's not just aging arteries. It's loss of arterial elasticity driven by inflammation, sugar metabolism, and mineral imbalance. 4. Low diastolic pressure can actually be a hidden risk for brain and heart perfusion, especially in older adults, where too low can mean your organs aren't getting enough steady blood flow. 5. Pulse pressure, the gap between the 2 numbers, may be one of the most important longevity markers. A wide gap often signals arterial damage and increased cardiovascular risk, even if one number looks normal. 6. Blood pressure is not just a heart issue. It's a full-body metabolic signal. Your liver, kidneys, hormones, nervous system, and even your sleep patterns are all influencing these numbers. As we go through each of these, I'm going to show you not just what's happening, but what to actually do about it. Because the goal here is not to memorize numbers. The goal is to understand your body well enough to correct the root cause naturally. Now let's start with the first, and probably the most misunderstood concept. Sign 1. The 2 numbers are not measuring the same thing, and this is where most people get confused. Most of my patients tell me, "Doctor, as long as my top number is okay, I'm not too worried." They assume both numbers are basically measuring the same thing, just in slightly different ways. But here's what's actually happening inside your body. These two numbers represent two completely different phases of your heart cycle. The systolic number, top, measures the pressure when your heart contracts and pushes blood out. The diastolic number, bottom, measures the pressure when your heart relaxes and refills. Now here's the critical part most people miss. Systolic, casts force of the push, plus arterial stiffness. Diastolic, hormone resistance in your blood vessels when at rest. So if your systolic is high, we start thinking about arterial stiffness, inflammation, and aging vessels. But if your diastolic is high, we look more at chronic tension in the vascular system, often driven by insulin, cortisol, and nervous system stress. This is why two people can have the same average blood pressure, but completely different underlying problems. Let me explain this with a simple analogy. Imagine your blood vessels like a flexible garden hose. When water is blasting through, heart pumping, the pressure you feel, that's your systolic. But when the water is still inside the hose between bursts, the internal tension in the hose, that's your diastolic. If the hose is stiff or narrowed, pressure behaves very differently, even when the flow looks normal. According to the American Heart Association, nearly 46% of adults have hypertension, and many cases are misinterpreted because people don't distinguish between systolic and diastolic patterns. My recommendation for every patient over 40, don't just check your blood pressure. Track both numbers separately for 7 days. Write them down morning and evening. Look for patterns, not just single readings, because if you misunderstand the numbers, you misunderstand the problem. Not next month, today. If this is helping you see your health more clearly, consider subscribing. I post videos like this every day to help you fix the root cause, not just manage symptoms. Now let's move to the next. And this one surprises my patients the most. Sign 2, normal top number, but high bottom number. And this one surprises my patients the most. Almost every patient I've seen with this says, "Doctor, my blood pressure is basically normal. The top number is fine." They assume that as long as systolic looks okay, they're safe. But here's what's actually happening inside your body. A normal systolic with elevated diastolic is often an early warning sign of metabolic dysfunction, especially insulin resistance and chronic stress activation. When insulin levels stay elevated, even if your blood sugar looks normal, it triggers your kidneys to retain sodium and water, and it activates your sympathetic nervous system. At the same time, cortisol, your stress hormone, keeps your blood vessels in a slightly constricted, tense state. The result? Your heart is pumping normally, but your blood vessels are resisting flow, increasing that bottom number. This is why I take elevated diastolic very seriously, especially in people under 60. Think of it like driving a car with the handbrake slightly engaged. The engine, your heart, is working fine, but there's constant resistance in the system. You might still move forward, but over time, that hidden resistance causes wear, strain, and damage. Research published in the Journal of Hypertension has shown that individuals with isolated diastolic hypertension have a significantly increased risk of developing full cardiovascular disease later, even when systolic is normal. My recommendation for every patient showing this pattern: start with a simple metabolic reset. Walk 10-15 minutes after every meal. Reduce refined carbs and sugar, especially at night. Prioritize your last meal at least 3 hours before sleep. This alone can start lowering insulin and relaxing vascular tension, because this is an early signal, not a harmless one. Ignore it now, and it becomes a bigger problem later. Sign 3. High systolic after 50 isn't just aging, and almost nobody explains this correctly. Most of my patients over 50 tell me, "Doctor, my top number is high because I'm getting older." That's normal. They've been told it's just part of aging, something to accept, not fix. But here's what's actually happening inside your body. High systolic pressure is not simply age, it's a sign of arterial stiffness. And that stiffness is largely driven by chronic inflammation, glycation, damage from excess sugar interacting with proteins, mineral imbalances like low magnesium and potassium, and long-term insulin resistance. When insulin stays elevated over years, it damages the delicate inner lining of your arteries, called the endothelium, reducing their ability to expand and absorb pressure. So when your heart pumps, instead of your arteries flexing smoothly, they become rigid, causing pressure to spike. Let me explain this simply. Healthy arteries are like soft, flexible rubber pipes. They expand when pressure increases. But stiff arteries are like old metal pipes. They don't expand, so pressure builds up quickly. Same heart, very different outcome. According to the American Heart Association, the majority of adults over 50 with hypertension have isolated systolic hypertension, which is strongly linked to increased risk of heart attack and stroke. My recommendation for every patient over 50: start restoring arterial flexibility naturally. Add magnesium-rich foods, spinach, pumpkin seeds, almonds. Get 15-20 minutes of sunlight daily for nitric oxide support. Include beetroot or leafy greens to improve vascular dilation. These support your body's ability to relax and expand blood vessels. And one more powerful tool: try 12 to 14-hour overnight fasting. It helps reduce insulin and inflammation over time. If this is helping you connect the dots, consider subscribing. I post videos like this every day to help you rebuild your health from the inside out. Because stiff arteries don't fix themselves. You either reverse it or it progresses. Sign 4. When the bottom number is too low, and this one is often overlooked, but critical. Almost every patient I've seen with this says, "Doctor, lower blood pressure is always better, right?" They assume that as long as the numbers are going down, they're improving their health. But here's what's actually happening inside your body. When your diastolic pressure drops too low, especially below 60 mmHg, it can become a problem. Because diastolic pressure is what maintains constant blood flow to your heart and brain between heartbeats. If it's too low, your organs may not receive steady, adequate perfusion. This becomes particularly important in older adults or in people aggressively lowering blood pressure without addressing the root cause. Low diastolic can be linked to overmedication, poor vascular tone, nutrient deficiencies, or even autonomic nervous system imbalance. So while high pressure damages vessels, too low can mean not enough oxygen delivery where it matters most. Think of it like an irrigation system watering a field. If the pressure is too high, then it damages the pipes. But if the pressure is too low, water never reaches the far ends of the field. Both extremes create problems, just in different ways. Research published in the Journal of the American College of Cardiology found that diastolic pressure below 60 mmHg was associated with an increased risk of heart events, especially in older adults. My recommendation for every patient, especially over 60, avoid overcorrecting aggressively. Instead, stay well hydrated throughout the day. Include electrolyte-rich foods like leafy greens, avocados, and a pinch of natural salt if appropriate. Stand up slowly and monitor symptoms like dizziness or fatigue. This helps maintain stable circulation and vascular tone, because lower is not always better. Balance is what protects you. Sign 5. The gap between the numbers matters more than you think, and this is one almost nobody talks about. Most of my patients tell me, "Doctor, I just look at whether my numbers are in the normal range. That's enough." They rarely pay attention to the difference between the top and bottom number. But here's what's actually happening inside your body. That difference, called pulse pressure, is one of the most powerful indicators of arterial health and aging. It's calculated simply, systolic minus diastolic. So if your blood pressure is 140/70, your pulse pressure is 70, which is considered high. A wider gap often means your arteries have become stiff and less elastic. Blood is hitting the vessel walls with more force, and your cardiovascular system is under chronic strain. This is especially important because you can have a normal diastolic, but still be at risk due to an elevated systolic creating a wide gap. Think of it like a hammer hitting a wall repeatedly. If the wall has cushioning, healthy arteries, the impact is absorbed. But if the wall is rigid and brittle, each impact creates micro damage over time. That's what high pulse pressure does to your vessels. According to research published in The Lancet, Increased pulse pressure is strongly associated with higher risk of cardiovascular mortality, particularly in individuals over 50. My recommendation for every patient concerned about this: start improving vascular elasticity daily. Do 30 minutes of brisk walking to stimulate nitric oxide. Add omega-3 rich foods like fatty fish or flax seeds. Reduce processed foods and seed oils that drive inflammation. These help your arteries become more flexible and responsive, because that gap is telling a story, and you don't want to ignore it. Sign 6. Blood pressure is not just a heart issue, and this changes how you approach everything. Most of my patients tell me, "Doctor, high blood pressure just means something is wrong with my heart." They think the heart is the problem, and the only solution is to control the numbers. But here's what's actually happening inside your body. Blood pressure is a full-body signal, not just a heart issue. Your heart is simply the pump, but the pressure is influenced by multiple systems. Your liver, which regulates fat metabolism and inflammation. Your kidneys, which control fluid and electrolyte balance. Your hormones, especially insulin and cortisol. Your nervous system, which controls vessel constriction and relaxation. Even your sleep quality, which affects recovery and vascular tone. For example, when insulin is chronically elevated, it tells your kidneys to hold on to sodium, increasing fluid volume. When cortisol is high, it keeps your body in a fight-or-flight state, tightening blood vessels. When sleep is poor, your body loses its ability to repair and regulate pressure overnight. So if you only treat the number, but ignore these root causes, the problem keeps coming back. Think of your body like a city water system. The heart is the main pump station, but the pressure in the pipes depends on reservoir levels, kidneys, pipe condition, arteries, control valves, hormones, and system demand, metabolism. If any part is off, the pressure changes. According to the Centers for Disease Control and Prevention, CDC, nearly 50% of adults with hypertension also have metabolic conditions like obesity or insulin resistance, showing how deeply connected this really is. My recommendation for every patient serious about fixing this at the root: start with a simple daily foundation. Prioritize 7 and 8 hours of quality sleep. Eat whole, unprocessed foods with balanced protein and healthy fats. Keep a consistent eating window. Avoid late-night meals. Manage stress with 5 to 10 minutes of slow breathing daily. These small actions regulate the systems that control blood pressure naturally. Because if you only treat the symptom, you miss the system. Now let's bring this all together. Because once you understand these patterns, you stop guessing and start making precise, intelligent decisions about your health. Blood pressure is not just 2 numbers on a screen. It's a real-time reflection of your metabolism, your vascular health, your hormones, and your lifestyle. Here's what we've uncovered. The top number, systolic, tells you about arterial stiffness and pressure during contraction. The bottom number, diastolic, reveals vascular resistance and recovery between beats. A high diastolic can be an early warning sign of insulin resistance and chronic stress. A high systolic, especially after 50, often signals loss of arterial flexibility, not just aging. A low diastolic can reduce blood flow to your brain and heart. Balance matters. And the gap between the numbers may be one of the strongest indicators of long-term cardiovascular risk. But more importantly, this is not just about avoiding disease. This is about improving your energy levels, mental clarity, fat-burning ability, sleep quality, and ultimately your longevity and independence as you age. Because when your blood vessels are healthy, your entire body functions better. So here's your challenge. Pick just one thing from this video and start today. Maybe it's tracking your numbers consistently, walking after meals, improving your sleep, or reducing sugar and processed foods. You don't need to do everything at once, but you do need to start. Because small, consistent changes in your daily habits can reshape your physiology over time, and your body will respond if you give it the right signals. If this added value to your life, take a moment to like the video and subscribe. Join me and thousands of others who are choosing to optimize their health naturally from the inside out. I'll see you in the next one.